millimeter, while in the posterior lens surface it's only changed by about 1.3 or 1.4 millimeter. So the majority, the change is primarily occur in the anterior surface rather than the posterior surface. And as I mentioned before, the change in the posterior surface was very subtle, and this is because due to the incompressible nature of the vitreous gel, and so that there wasn't much room for movement on the posterior lens surface. So in this diagram, what I want to show you is, so here are 4 different patients, and for the first row here is, if you look at the legends here, so this is a 21 years old student or subjects. Okay, so this is the 0. Okay, zeros, that means they are looking at a distant object, and that's why the stimulus to accommodation is 0. Okay, so there's no stimulus. Okay, so this is a 2 diopters of accommodation, this is a 5 diopters of accommodation, and this is the 7 diopters of accommodation. And the first row is a 21 years old subject. Okay, and on the right hand side, so this means is the maximum amounts of accommodation that the subjects can achieve. So in the first subjects, 21 years of age, so he or she can have up to 7 diopters of accommodation. And the second subject is 28 years old. Okay, so almost like a 10 years different, and you can see that this is the maximum amounts of accommodation he or she can achieve. Okay, so by increasing the age of almost like 10, it reduced the amplitude of accommodation to 7, from 7 to 5. Okay, and the third row is I think it's about 39. Okay, it's almost like 40 years old, and 40 by 40 you only have about 4 diopter left for accommodation. And this is the last one is 57 years old, and you can see that the maximum accommodation reduced down to about a little bit more than 1 diopter. Okay, so as you can see here, so the increasing the age will cause a reduction in the amplitude of accommodation. Okay, so that's is related to the presbyopia. Okay, so the maximum of accommodation reduce over time. Okay, and if you look at the first row, what you can also see is that the lens, I think probably this one is more obvious. You can see that the lens curvature reduce. Okay, the radius of curvature is reduced with higher accommodation compared with the control, for example. So you can see that the R reduce here as compared to, for example, like 0. So in this case, the radius of curvature should be like more flat when looking at a distant object. Okay, and the other things that you can observe is that the lens clarity also change. I mean, if you look at the pictures along the vertical axis, 20 years, 20, 30, almost like 40, this is almost 60. So you can see that the clarity of the lens reduced, the transparency, I mean. So this is because of the development of the cataract. Particularly in the last one, you can see that the lens is not very transparent, okay, under different condition, okay. And when the subject is very young, usually you can see that the lens is very clear. Okay, so that's related to the amplitude of accommodation. Remember the figures that I showed, the diagram that I showed you on the right hand side is the maximum amounts of accommodation. So we call this amplitude of accommodation. It's the maximum magnitudes of accommodation you can achieve. And we find that this AA amplitude reduce with age. Okay, and that's why the people will develop presbyopia, LOFA. And some research studies show that the rate of decline, for example, if you compare the people who are Caucasian, like people living in the States or in the UK, usually the rate of decline is a little bit higher than Chinese people. Okay, so you can see that it's about 0.4 diopter per year. Okay, so by 10 years, so it will reduce by 4 diopter. Okay, and you can see that in Chinese, one of the study conducted by Professor Marian Edwards. So she used to teach here back in 1993, and she find that the rate of decline in the Chinese is only about 0.3 diopter. Okay, So this is this diagram showing the decline of accommodation over time. Okay, so now you are around maybe less than 20. Okay, so you still have a quite a bit of accommodation, and then but you can see that by 40 years of age, your accommodations will be reduced down to about 5 diopter. And at 60, okay, so you still have a little bit, but it's not much, maybe 1 or 2 diopter. And and uh, and okay, I can talk about this here. Okay, and this is related to one of the conditions called the presbyopia, as I just mentioned. Okay, so this is a refractive condition. I'm sure if you talk to your parents, they may have this, they may already have this condition, or they're going to have this condition very soon. So usually they start at about 40. Some people will be a little bit late, maybe around 40 something, or maybe by 50 they will have this condition, and some may even start earlier. For example, like people, the Caucasian people, sometimes even at late 30, they will have this presbyopia condition. Okay, so this is a refractive condition in which the accommodation's ability become weaker for satisfactory near vision. So you can see that this is we put down satisfactory here. So satisfactory, that means whether the patient is satisfied with his near vision or not. So you can see that this is a little bit um, subjective. Okay, so different patients. So because um, they may have different job, and the visual task may also be different. So some people may need to have very good vision, near vision. Some people may be not. So that's why the presbyopia is not like an absolute condition. So it will subject to the patient whether they need to have good near vision or not. Uh, without the use of the corrective device. Usually it will be in a form of a positive lens or convex lens, okay, a positive lens which will help them to get the extra positive power. At young age, usually the AA, the ambulative accommodation, is very high. Some people can go up to about, for example, in kids, they can have more than 10 diopters of accommodation. So more than 10 diopters, that means they can put the objects at a distance less than 10 centimeter and still get a very clear vision. Okay? While at 60, remember, if you look at these figures, so we still have some accommodation, ambulative accommodation. Okay, but in fact, sometimes this may not be the real accommodation. So this could be part of the DOF. DOF is the depth of focus, uh, meaning that because usually in elderly, so their pupil will be constricted, and that's why we have this term, the senile miosis. Okay, so that means the pupil size is usually reduced in elderly. When you have a smaller pupil size, remember, just like when you take visual acuity, or if you like taking photographs, I think you may also know that if you have a smaller aperture, usually if you use visual acuity as an example, if you put a pinhole in front of the eye, having a smaller aperture, so usually your visual acuity will be improved because it will cut all the light wave coming from the periphery, and that's help to sharpen the image. So it's very similar to this condition. So when you're talking about elderly people, okay, so because the pupil are usually smaller, and therefore the depth of focus will be increased. So, and that's why they can see the task more easily. It is something to do with the accommodation. Maybe they lost all the accommodation, but since they only have a very small pupil, and which will also help them to improve the vision. And also, like I don't know if you have done this in your secondary school, the what we call the pinhole camera. Okay, so if you want to make a good pinhole camera, okay, you need to make a very tiny hole. So you cannot make a very big hole. If you want to get a very sharp image, very robust and a high quality image, you should have a very small, like make a very small aperture. Okay. So for high probe, okay, usually high probe, because they don't have sufficient amounts of the dioptric power, particularly in the uncorrected stage. So that means they are not using any contact lens or spectacle. So for people who have hyperopia, so if you still remember the topics on emetropia, so one thing they can do is that they will use part of the ambulative accommodation to compensate for their distant vision. Say, for example, if you have a patient, for example, a young children who have who may have like 2 diopters of hyperopia. Okay, if they have 2 diopters of hyperopia, so they will probably see a blur image at distance. Okay, because the total dioptric power is not sufficient to bring the distant objects on retina. So because of the hyperopia, the image will be forming behind the retina. But of course, the patients would prefer to have a clear image. So what they can do if they have 2 diopters of hyperopia is that they can accommodate. When they accommodate, they can increase the total power of the eye